What if I told you that the biggest problem in healthcare today is not cost, not access, not even technology? It's how we define the problem itself. The United States spends more health dollars for healthcare than any nation in human history. We have world class hospitals, groundbreaking technology, and some of the most highly trained professionals in the world. And yet, the patients feel lost. Physicians feel, physicians feel burned out, and systems feel unsustainable. Which raises a difficult, necessary question. Are we trying to fix healthcare or are we trying to fix the wrong version of healthcare? Because when we define the problem incorrectly, every solution, even the brilliant ones, moves you further away from what actually matters. Early in my clinical and administrative experience, I saw something that stayed with me. Two patients could walk into the same system with the same condition. One would navigate it smoothly, with clarity, coordination, and confidence. The other would experience confusion, delay, and fragmentation. Same system, same resources, but completely different outcomes. And it becomes clear to me that healthcare is not just a clinical system, it's a coordination system, it's a human system, it's a design system. And yet, we often try to fix as if it's a purely a technology or a funding problem. And we invest billions into new tools, new platforms, new innovation. But the experience of care remains fragmented. That's when I realized healthcare is not failing because of a lack of intelligence or effort. It is failing because it's designed for a different era. There are three fundamental problems in healthcare that we are solving the wrong way. Problem one, we treat healthcare as an episodic instead of continuous. Healthcare today is built around events, a visit, a diagnosis, or a procedure. But health is continuous. It evolves every day, between visits, between diagnoses, between interventions. By focusing on episodic care, we miss the opportunity to manage health proactively. We intervene late instead of guiding early, and this creates a system that is reactive instead of preventive. Problem two, we optimize for transactions instead of outcomes. Healthcare systems measure activity, number of visits, number of procedures, number of interventions. But activity is not the same as outcome. True success is not measured by how much is delivered, but how little care is ultimately needed. The healthiest system is not the one that treats the most disease, it is the one that prevents it. Problem three, we design systems around institutions instead of people. Healthcare is structured around hospitals, clinics, and organization. But patients experience healthcare as a journey, not as isolated institutions. They move between providers, specialists, and systems. And every transition creates friction, risk, and uncertainty. The burden of coordination falls on the patient, the one person least equipped to carry it. This is not a technology failure, it is a design failure. The future of healthcare requires three fundamental shifts. Shift one, from episodic care to longitudinal care. Healthcare must evolve from treating patients or treating the moments in patients' life to managing their entire journeys. Continuous engagement, continuous monitoring, and continuous guidance. I would suggest a single point of care like a patient navigator. Not just when patients enter the system, but before they need to. So they have a clear picture what they are exactly getting into. Excuse me. Excuse me. Bless you. and how they can navigate this. Shift to the shift from volume based care to value based care. Value based care is the new mantra. The incentives must align with outcomes, not the activity. When systems are rewarded for improving health, not just delivering care, the entire behavior changes. Innovation becomes aligned with prevention, efficiency, and sustainability. Shift 3, from institution centered to human design centered. Healthcare must be designed around the patient's experience, not the provider's convenience. Simple navigation, clear communication, and seamless coordination. Technology should support relationships, not replace them. The most advanced healthcare system is not the most complex. Simplicity is the key. Simplicity guided by your core passion or your core belief, which is passion for me, is the key to make the hardest task easy to implement. The smartest people think complexity is how they display their cleverness, but the more simple the solution, the more simple the implementation, the more simple the definition of the problem, the easier it is to adapt, the easier it is to continue, and the easier it is to complete the cycle and get a result and create impact. It is most clear, the most aligned, and the most human when we are able to design a human-centered design. Conclusion: healthcare does not need more effort. It needs more clarity. It does not need more complexity. It only needs a better design. The future of healthcare will not be defined by who has the most technology. It will be defined by who understands the human journey more deeply. Because the true purpose of healthcare is not to manage disease, it is to preserve function, dignity, and quality of life. And the leaders who will shape the future are not the ones who simply improve the existing system. They are the ones willing to reimagine it entirely. The question is no longer, how do we fix healthcare? The question is, how do we redesign healthcare around the people it is meant to serve? An answer to the question will define the next generation of healthcare leadership. So, what are the 3 problems that we define that are plaguing our healthcare today? Number 1 is we treat healthcare as episodic, but the solution, it needs to be a continuous process. We optimize for transactions instead of outcomes. Let's shift from a volume-based model to a value-based care system, and that is the solution. And the third one, we design people around the systems around institutions and not around people. By shifting our focus to human-centered design, we can solve this problem because we are addressing the core value of creating or generating results is how do I serve and who am I serving and how I am serving. The why, how, and what of the value proposition is the key to designing how we can turn around the net outcome of healthcare and bring in the true values that are necessary, which will create the maximum benefit to the people we are trying to serve. We are going to preserve the health, dignity, and quality of life rather than focusing on disease. Thank you.